Welcome to this explainer. Okay, let's just go ahead and call out the elephant in the room, those pre-exam nerves. If you're feeling a bit overwhelmed by the absolute mountain of information in your textbook right now, believe me, you are not alone. But today, we're going to be study buddies. We're going to conquer Chapter 1 together. We're taking all that dense material and distilling it down into a streamlined, completely manageable survival guide.
So let me ask you straight up. Are we ready for our skills exam? Because, it's totally normal to feel like there is just way too much to memorize. But I promise, even though that textbook looks endless, we can absolutely break down exactly what we need to know to pass. This explainer is all about getting us into that exam prep mentality. Separating the noise from the absolute essentials. All right, here's our study checklist for today. We're looking at the professional student, navigating healthcare settings, mastering core care procedures, roles in the care plan, and wrapping up with patient rights and privacy. Let's dive right into Section 1, the professional student. Look, first impressions really do matter in healthcare, and our professionalism, that's being graded from the exact second we walk into that room, literally before we even lay a hand on a patient. Notice how professional grooming isn't just about, looking nice. It's completely about patient safety and infection control. Being a professional student means wearing a clean, unwrinkled uniform. It means keeping our nails short and absolutely no false nails, guys, keeping our shoes and laces clean, and pulling our hair back securely away from our face. When we show up to our exam presenting exactly like this, we're silently telling that evaluator, hey, I take my patient safety seriously. Moving right along to Section 2, navigating healthcare settings. Now, when we're tackling the written portion of the exam, we're going to encounter a ton of terminology about where we actually work and how care is funded. So let's strip away all the medical jargon for a second. We really need to nail down the clear distinction between acute and chronic care. Acute care, that means a condition is sudden, severe, and usually has a common cure. Think of like a broken bone or a sudden infection. Chronic care, on the other hand, deals with conditions that are gradual, where a full cure is rare, stuff like arthritis or heart disease. Keeping these two side by side in our minds is absolutely crucial for the written exam. Next up, we have to contrast how healthcare is actually funded. You're going to see these two terms constantly, Medicare and Medicaid. The crucial takeaway here is that Medicare is a federal health insurance program primarily for folks who are 65 and older. Medicaid, however, is a medical assistance program, and it's largely based on financial need rather than age. And to really lock this into our memory, check out this visual of the empty wallet. Medicaid is specifically for people with low income who must qualify for the program based on their financial situation. So if you ever get the two jumbled up during the test, just picture someone checking their wallet. Medicaid provides medical assistance for those with low income. Okay, on to Section 3, mastering core care procedures. All right, focus up because this is the absolute climax of our study session today. These are the critical make-or-break steps we absolutely must perform for every single clinical skill during our test. Before you start anything, you have to run through this beginning sequence. First, identify yourself by name and identify the resident. Second, wash your hands. Third, explain the procedure. They have a right to know what's going on, right? And provide privacy. And fourth, adjust the bed to a safe level, usually waist high, and lock those wheels. Understanding the why is super important here. We raise the bed to save our own backs from injury, and we lock the wheels to prevent the patient from falling. It's all about safety. And just like we have an opening sequence, we have an ending sequence. Think of these steps as the bookends for every single procedure you do. When you're finishing up, you got to return the bed to its lowest position. You must place the call bell directly within the patient's reach. Then, wash your hands again. And finally, report any changes and document. Leaving the bed low and the call bell right there, that is exactly how we keep our patients safe the minute we walk out of that room. Do not forget these steps in front of your evaluator, for sure. Now, here's a term you're going to use constantly on your shifts and definitely see on your exam, ADLs. That stands for Activities of Daily Living. Let's get this defined clearly in our minds right now. ADLs are the basic self-care tasks that we assist our residents with every single day. We're talking bathing, dressing, eating, drinking, mouth care, and walking. Honestly, this is the bread and butter of our role. And speaking of our role, let's talk about the very first skill you'll probably have to perform, hand hygiene. Listen, hand washing is a whole different ballgame in healthcare. Evaluators will be watching us like hawks, and they will be counting. We have to wet our hands, apply soap, and lather all surfaces of our wrists, hands, and fingers, producing friction for at least 20 seconds.
And remember your technique. Keep those hands lower than your elbows and your fingertips pointing down. Why? So the dirty water washes away into the sink, not back up your arm.
Let's shift into Section 4, Roles and the Care Plan. To ace our exams, we really have to know exactly where we fit into the nursing care team, and honestly, what falls strictly outside our scope of practice. So let's run through a quick exam-style checklist to cement this. Keeping resident areas neat and charting. True, absolutely. Giving tube feedings and medications? False. No way. That is way outside our scope. Doing absolutely everything for the resident? False again. While we're obviously there to help, promoting the residents' independence is just vital. We want them doing as much for themselves as they safely can. When you're helping a resident, you are strictly following their care plan. I really want to stress that the care plan isn't just some boring piece of paperwork filed away in a binder. It's a highly individualized guide for each specific resident. Yes, it involved input from the family, but here is the absolute most important thing to remember. The patient always has the final say. They are the boss of their own health goals, and the care plan reflects their choices.
And that brings us to our final section, Section 5, Patient Rights and Privacy. As healthcare workers, we don't just provide physical care. We're bound by some incredibly important laws designed to protect the vulnerable patients we serve. You're definitely going to see questions about OBRA, the Omnibus Budget Reconciliation Act. Let's summarize it real quick. Passed in 1987 because of reports of poor care, this is the literal law that mandates your minimum 75 hours of training and requires you to pass the very competence and skills exams we're prepping for right now. But beyond our training, OBRA guarantees fundamental rights for our patients, like the right to privacy, the right to make independent choices, and the absolute right to complain without any fear of retaliation. We are their advocates. The other major piece of legislation you absolutely must know is HIPAA. Simply put, HIPAA is our legal obligation to keep protected health information, or PHI, completely confidential and secure. We're talking names, addresses, medical record numbers, diagnoses, the whole shebang. This means no gossiping about residents in the break room and zero sharing of records with anyone who isn't directly involved in their care. Because in healthcare, privacy isn't just polite, it's the law. So as we wrap up our study buddy session today, I'll ask you one more time. Are we ready to protect our patients and completely crush this exam? Just look at everything we've broken down. You know what true professionalism looks like. You understand the core procedures to keep patients safe. You know your exact role, and you know the laws protecting the people in your care. You have the knowledge locked in to absolutely ace your skills test. But here is something to think about. Once you pass that test and walk into that facility on day one, how will you use these very rights and procedures to change your very first patient's life? Think about it. Keep studying, and we'll see you next time.